didn't say anything.
Thought you said something.
I was just clearing my throat.
Okay. Maybe you're coming down with something.
I'm all right. Just wanna...
Just what?
It's just a waste of time sitting here week after week. It's wasting time.
I don't want you to waste your time, Antwone.
So what you want me to say?
It's not what I want you to say. It's what you want to tell me.
The classic turntables of therapy. God, I love this kind of stuff. Hey, everybody, and welcome to the Cinema Psych Podcast, the podcast where psychology meets film. I'm your host, Dr. Alex Swan, and in today's episode, we are going to explore one tiny facet of cinema, and more specifically, an important facet of cinema, the biopic. The biopic. In this episode, we are talking Antwone Fisher. 2002 film starring Derek Luke as the titular character and Denzel Washington. Interestingly enough, his directorial debut. This is also Derek Luke's Hollywood debut. So a lot of debuts happening in this movie, which I think is quite interesting. The film title, Antwone Fisher, is based on a true story and a real person. The real Antwone Fisher wrote an autobiography entitled Finding Fish, and the real Antwone Fisher is credited as a screenwriter. So in the story, Antwone is in the Navy, and he has a bit of an anger problem. He attacks a fellow shipmate, and at a captain's mast, he is demoted and sentenced to confinement on the ship and therapy.
Yeah, okay. You know, one day Chief gonna come in here and catch you taking them Hollywood showers. I should snitch on you. Come on, move, man.
Get out of my way,
oh,
snitch.
Come on, move, man. Oh, yeah, yeah. Whoop. I got you, man. Oh, mercy. Quit playing, man.
It's cracking, Fisher.
Your head if you don't get away from me.
What is that on your face?
Say something! Say something! Huh? You always talk! Get up! Why do you gotta cool, man? I'm cool, man. Relax.
Cool, man.
Petty Officer Fisher, you've been accused of violating Article 128, assault on a superior non-commissioned officer. How do you plead?
Guilty, sir.
Well, in your statement, you say your attack on Petty Officer Berkeley was provoked by a racial slur. Is that correct?
Yes, sir.
Petty Officer Berkeley, did you make any racial remarks to Petty Officer Fisher?
No, sir.
Berkeley!
Stand at attention. This is the United States Navy, son. I find you guilty. There'll be a forfeiture of $200 for 2 months. You'll be restricted to the boundaries of the ship for 45 days, and you perform 45 days extra duty. I'm reducing you from ship serviceman petty officer 3rd class to ship serviceman seaman. And I'm recommending that you be evaluated at the psychiatric clinic before our next underway period. You're dismissed.
So what happened? How'd it go?
Same old, same old. I got busted, but now I gotta go to the psych clinic.
You gotta go to the nut house?
Mama, shut up, man.
Give it up to the strike? Damn.
Denzel Washington's character plays Lieutenant Commander Dr. Jerome Davenport, who is the Navy therapist that he goes and sees. Okay. Psychiatrist, I would imagine. They don't really make that very clear, but in any case, that is what I took from it. So Antwone has to go see Dr. Davenport for treatment of his anger issues. I don't think they really cared how he was going to get treated. At least the Navy probably didn't care how he was going to get treated, what was going to come of his treatment. But we learn through several sessions and an ongoing building relationship between Davenport and Fisher that Antwone's past is really traumatic. His father was killed before he was born. His mother was a teenager, ended up arrested, most likely from what we can gather in the film, drug possession and drug use. And so she was imprisoned, and little baby Antwone was put into an orphanage and basically held there until his mother, got out of jail and could claim him, but she never did. And at 2 years old, Antwone was placed in foster care run by Mr. and Mrs. Tate. These individuals were part of a sort of a revival church, running a church business, so to speak. And unfortunately, he suffered a number of instances of emotional abuse, especially at the hands of Mrs. Tate. And we learned that he was molested by her adult niece, Nadine, until he runs away at age 14. And when he's able to, after living on the streets, joins the Navy. And that's where we meet him. And we'll talk about the rest of the plot and his coming to terms with this history, this trauma, with our guest, who I think is the perfect person to talk about this film and its psychological underpinnings and concepts and themes. So we'll jump into that. Before we do, I want to take a moment to let all of my listeners know that my audiobook/audio course is now available on Audible, audible.com, Audible app. It's only available on Audible, so it was an exclusive on Audible, and it's called A Psychologist Goes to the Movies. Over the course of 6 episodes, which are about 25-ish minutes long, I discuss 6 films that you may be familiar with and have appeared on this show. So please take a look at it. If you've got a Premium Plus account on Audible, it's part of your membership. If not, consider giving it a listen. I go into far more detail than I have and explaining the research than I have on this show, speaking with several people. So that, again, is A Psychologist Goes to the Movies, available on Audible, audible.com, the app, and all of that jazz. So I appreciate it. I've been waiting a few months for it to come out, and it's now available. So I'm very happy to share that with you all. Now, let's jump into the episode, shall we? My guest host today is Dr. Katherine Marshall Woods. Katherine is a media psychologist and licensed clinical psychologist in Washington, D.C. She spearheads Psych-Minded Media, a psychological media firm that affords her the opportunity to work with actors, screenwriters, producers, directors, and collaborate with film festivals in the U.S. and abroad. She is also the director of graduate studies at the George Washington University Professional Psychology Program and is in private practice in Washington, D.C. She has authored the book Best Psychology in Film, which has become a 2024 Telly Award-winning television show and podcast that she produces and hosts with UDC TV. Katherine, welcome to this show.
Thank you so much for having me, Alex.
I am so thrilled to have you on. Now, before we jump into discussing Antwone Fisher, I wanted to ask your thoughts on the film in general, like the filmmaking, since we're kind of in the same nerddom here. This is part of, loving film is the craft, right? So about Antwone Fisher, before we get into the psych stuff, what did you think about the movie?
I love the movie. The story itself is very heartfelt. It shows the challenges that someone can go through. It is a screenplay that is about his life that he wrote. So it's very obviously personal to him. The actual film, I love the sound quality of the film. Yeah. There's like a bell that rings at a door, and it just sets the tone for that scene and ends actually the scene very nicely. The lighting, the makeup actually was wonderfully done, specifically showing like how someone's skin may look when they are impoverished. I mean, it just was a wonderful film. And then, of course, you have these interpersonal dynamics that are happening that will make you fall in love with the film.
What did you think about Denzel's first directing job?
Wonderful.
Would you consider yourself a Denzel fan?
I was going to say, when does he go wrong?
Yeah, right.
But yes, I would, of course, consider myself a Denzel Washington fan. I mean, his acting is unreal, and his ability to improv within films is just amazing. What he can do when he understands the character and is able to pull from the character and pull from the environment that he has, like, actual props from the scenes in order to enhance the way that he manifests his characters. Yes, I am a Denzel fan. I feel like he is a genius when it comes to acting and being able to portray something that's going to be horribly moving for audiences and will live with them for a lifetime. So yes, I am a fan.
There's several scenes where it's just like deep, heavy sobbing kind of material. Yeah, I agree. I think he did a wonderful job in his first go, and even with him in several of the scenes too.
Yes.
Now, a similar question, because this is Derek Luke's sort of, and not his first acting gig, but his first Hollywood acting gig. Like, this was his Hollywood debut. How did he do in your mind as portraying the real Antwone Fisher?
Well, I don't know the real Antwone Fisher, but I imagine he is. I mean, I'm also a Derek Luke fan. I think that I wish I saw him more often on screen. He is, I think, just also a brilliant actor. And again, like you said, this was his Hollywood debut, and he was, relatively young in the film. And I just imagine his craft will get more enhanced while he becomes a more seasoned actor. But given that this was, let's say, his first Hollywood debut, he did a fantastic job that evoked those, like you say, sobbing moments. And he was able to carry that all on his own as well. So
yeah, there were a lot of scenes where I thought he was going to, especially when he was when they're doing the whole search for the family in the latter part of the film. I thought there were several times I was just on edge that he was going to leave his girlfriend and be like, I'm giving up or whatever. But he just kept trudging on, and he carries that weight with him, Derek Luke, with him in each subsequent scene. Like, it gets heavier and heavier. And then he meets his mother, and he sees the kind of situation that she lives in, which is in squalor, and she's still struggling to make it, maybe still doing some drugs, if not drinking herself to the end. And he gets in there and he forgives her. And it's just like, wow. And then the scene right afterward, when like he goes back to his new family's house, and everyone is there, and they have this great meal, and you're waiting for who appears to be the matriarch of the family, just like say, welcome. So glad that you're home. And it's so good. Very beautiful story. And going into it with sort of blinders on, because when I get a new film to watch for the show, I try not to read anything about it until I watch it. And so the movie for me started out a lot differently than I thought it was, that I thought it was going to end. And I thought it was going to be a tragic story, the way that it was set up. But it turns out it's actually a really good feel-good story. And you're like, man, good for Antwone. Like, even the real Antwone, like, good for him.
Yes.
And how often do you get to see that? You know what I mean?
Right. It actually belies what you think will be what's going to come. And that is actually, I think, what makes this story so beautiful, because you get to have a triumph after all.
Mm-hmm.
And you're rooting for this character, despite how he manifests a lot of his feelings at the onset of the film. You're still rooting for him.
Yeah.
And one thing that, going back to Derek Plute's talents, is that when he becomes intensely engaged into this character, the intonations in his voice, there's always this crack in his voice when he goes up, and it just shows like how in tuned and passionate he is when he's communicating these words and helping the audience and bringing them on this emotional journey with him, that I feel like it's hard not to invest in this character, and you're hoping that things work out for him. And when they do work out for him, it brings about another set of tears.
Right.
I used to dream about you. My mother, what you be like, how you look, your voice and your smile, even your scent. For all these years, I wondered about you. I dreamed about you. Didn't you miss me? On the way to school each day, I imagined you were just around the next corner. When I get there, you would be there. And in my mind, you was always there. You just couldn't find me. So I raced to the next corner, and you'd be there. I know you would. Then you would buy me ice cream. And then you would take me home. I'm a good person. I'm a good man.
You reached out to me as just a cold email, and I really enjoy getting these kinds of emails. I do get a lot of spam. I do occasionally get emails like yours, where you mentioned that you had written a book, and it prompted us to talk a little bit further about it. And could we take a second for you to explain to the listeners what this book is about and why we're talking about Antwone Fisher today?
Yes. Right. That's a very good question, considering Antwone Fisher was made in 2002.
Right.
So it's an aged film. And it aged like wine, I would say. It gets better, I feel like, with age.
Yeah, you don't really see 2002 too much in it, which I think it's a good thing. I mean, phone books. They use phone books.
Yes, they do.
Which is kind of funny, but that's about it.
Yes. The book, yes. The book is called Black Film Through a Psychodynamic Lens. It's my second book. This one was published by Routledge Publishing Home. And the book is about 100 years of Black film. And it talks about, for the first 50 years, about just our presence within Hollywood, how we were able to make our name and put our feet into the Hollywood scene, and become respected in that capacity. And then what happened from 1980 all the way until present day. And it really highlights 65 different films, all
65.
65,
wow.
All broken down within decades. So you'll have a set of films from the 1980s, a set of films from the 1990s, the 2000s, blah, blah, blah. And it goes over really these common themes that we see in films, specifically Black films. It talks about what was important to us as a community and how those issues and those concerns were depicted within films. And it uses this psychoanalytic or psychodynamic lens, more Freudian way of thinking about interactions with other individuals, how we understand ourselves. And so it provides a psychological breakdown of some of the characters and the global themes of these films as well.
Excellent. So I want to take a little piece of what you just said there. So, and I explained this to you before we started recording, but as a cognitive psychologist, I'm pretty far away from clinical and even farther away from psychodynamic, psychoanalytic theory. So for the listeners, could you explain what that means? So what is this perspective that you're coming from to explain these films in the book, and how that relates to, of course, Antwone Fisher that we're talking about? What is psychodynamic psychoanalysis theory / Freudian, if you want to put him in there? What does that mean?
Yeah, that's a really good question. So really, it's the starting off with the base is that who we are today is a reflection of who we were yesterday and the day before. That our early childhood experiences shape who we become, our attachments with our caregivers, how we navigate challenges within our life, what defenses we use, like do we use denial, do we use rationalization, do we use intellectualization, and how we use those defenses in order to cope with our stressors. Are they working for us? Are they not working for us? And then it's the idea of how does all of these conflicts that we experience and the defenses we use, how does it help us either navigate our world healthfully and happily and allow us to thrive, or how are those defenses and those overwhelming feelings that we may have, they're not working for us and we're struggling to manage those feelings. And so that's where therapy comes in, is building this therapeutic rapport, this relationship that we realize or we believe is that the patient comes into the therapy room and they begin to reenact their early childhood experiences with the therapist. This is transference. And how we feel about our patients is countertransference based upon our early childhood experiences.
Interesting. Okay.
So this is where we fall.
Okay. I think that is probably the best explanation that I've gotten ever in my training, right? When I was
I'm also a professor, so
yeah, exactly. So when I was in graduate school, the psychology department, I was about to call it my department. No, the psychology department where cognitive and neuroscience and all of that stuff was housed was separate from where clinical counseling and school psychology was. They were all, and like physically too, they were all on the other side of campus, and they were in a different school. They were in the Graduate School of Education, and we were in Arts and Sciences, or something like that. Different schools. And so we rarely intermingle. We sort of had grad student events here and there, but at those events, like, we weren't talking about, science. Those were for like offloading everything else. So I never really got a good, succinct explanation like you just provided. So I appreciate that. And I think I'll probably come back to that quite frequently. I don't normally talk about Freud except in history of psychology, and so but it's useful, so I appreciate that. So in that vein, let's jump into Antwone Fisher.
Sure.
This young man is in the Navy, and he has a bit of an anger problem, and he expresses his anger physically.
Yes.
And so he is assigned, he's demoted, which is interesting in and of itself, but he is also assigned to what is it? I think it's 3 sessions with a Navy psychiatrist, is what I assume that Denzel Washington's character, Dr. Davenport, that he is a psychiatrist. So he has a medical degree. And so he is not provided with medication. I wonder if that's a Navy thing. Maybe back in 2002, that was a Navy thing. But he wasn't given any medication, just to go through this like psych evaluation. And so I wanted to, as a practicing psychologist, Katherine, I wanted to get your sense of those meetings early in the film, like Act 1, we'll say, where they actually he goes to the office and he sits down, and at first he's antagonistic toward Dr. Davenport, and Dr. Davenport's like, I could do this all day. So what is your sense as a professional in this field about how they portrayed the interactions between Antwone and the doctor?
I think that the way they captured the therapeutic sessions are extraordinarily accurate.
Okay.
Strangely enough, now in retrospect and thinking about this, which is just coming to mind, we stated that he was in the Navy, and yes, he was in the film, is that I actually worked with military personnel, active military personnel within Doha, Qatar.
Oh, wow.
And so I've actually worked with Navy men. And so it is interesting to have this parallel of Dr. Davenport treating him in this capacity. And I've actually had those real experiences. And it is extremely accurate.
Okay.
The lack of trust that he had with this psychiatrist, the fact that it was only going to be very short-term therapy, so why should he invest? And the disbelief that someone would be able to invest in him in 3 sessions seemed pretty, again, accurate to, I believe, how most people would feel when they are in that sort of situation and then receiving therapy services, particularly having a history of abandonment and unsafe relationships.
Sure. Yeah. So because you've had this experience, and I'm sure you've had similar experiences with others here in the States, I'm curious if the seamen that you talked to were anti-therapy, or I guess in another way of saying it, like held the belief that therapy wasn't worth it, wasn't going to do anything, wasn't going to be helpful, that kind of thing.
Sometimes. I think that a number of times it was just anxiety and fear.
Okay.
I mean, the reality is that at least the time when I was practicing in that capacity is that if an individual showed that any challenges with psychological means, the question would be, are they fit in order to serve? And that would actually change their ability to be employed in the military.
Okay.
So there's a lot of fear that goes into having an honest conversation regarding the challenges one experiences, because they also want to continue to be employed. And so there's that, there sometimes is that barrier. I think in the film, Antwone Fisher, however, that isn't necessarily portrayed, but it does seem like there's this fear of this person getting close to him and whether or not he's going to be someone who's safe. Is he going to be someone who's injurious or take advantage of him in any way? And so his guard is just very high up, and his defense mechanisms are so thick that you have this literally a kind of a brick wall to be able to get to right to be able to get to who he really is, what his feelings are, and really get to know him.
Maybe you can start by asking me a question. I don't know, get things going.
I can do that. You said you come from under a rock. What do you mean by that?
I don't know. It's the first thing to come to my mind. What you think it means?
Well, it could mean that you feel under pressure, that you feel a weight pressing down on you, that you're in the dark, that you're alone. You said you had no parents.
I had parents.
Okay.
Only 3 sessions, right?
Only 3.
My father's name was Edward.
So you knew him?
No. I didn't even know his last name.
You know where he is?
Yeah, I know where he is. He went to his ex-girlfriend's house. They got into an argument. She killed my father.
Where was your mother when this happened?
Behind bars.
I see.
I was born in prison 2 months after my father was murdered.
Why was she confined, your mother?
I don't know. All I know is what I told you.
So you were turned over to the state?
Yeah. The state placed me in this orphanage. It was supposed to be until my mother got out to claim me, but she got out, but she never claimed me.
How long were you there?
2 years.
How does that make you feel, Antwone?
I don't know.
Come on, you must have had some feelings about it. What did it feel like?
Rainy days.
Like rainy days? Okay. Why is that?
You know, in Cleveland, it rains. Not all the time, but to a kid who wants to go out and play it, It seems like it rains every day. But kids expect it to rain sometimes, but for one kid, it rained too much.
Okay.
You want me to come back next week?
Yes, I do. You ever try to find her, your mother?
No, sir.
Okay. Next week.
So there is a couple of scenes that sort of mirror each other, parallels to each other. His Antwone's first session and more or less his second session. And I wanted to get the sense from you. I'll give you a lead in with my experience. So when I was in graduate school, I also went to therapy, and I saw somebody who specialized in CBT, cognitive behavioral therapy. And my first session, I sat down and I was looking at the doctor across from, her little office space. And I kind of just sat there, and she was waiting for me to talk. She was waiting for me to begin the conversation. And you see that in the movie as well. Antwone says, I think in the second session, he says, like, so what am I supposed to say? And Davenport says, it's not what you're supposed to say, but whether what you want to tell me, something along those lines, probably paraphrasing there. But in your experience, is that something that is part of the ethos of a practitioner to wait to speak?
Absolutely. And there are times you wait for 5 seconds, and then there are times you wait for 50 minutes, and then you close the session and you try again the next session,
Okay.
Right? There is a defensive silence where an individual may just say, I don't want to talk, and I'm going to utilize my power and autonomy not to do so. And hopefully the therapist respects that.
Okay.
Right? But then there's also, I feel like in the film, there's also this aspect of lack of knowledge as to what to do with this time. There is this person sitting in front of you, and they're looking to engage with you, and you're waiting for them to take the lead. Now, again, there's maybe an unfamiliar aspect to relating to a man, because we don't see Antwone Fisher relating to any men initially in his early childhood years.
Yeah.
The ones that he is relating to are the ones that are his commanding officers. Sure. And so it's like maybe he's waiting for permission to communicate. And then, not everyone knows what to actually do with therapy, right? They're like, well, what am I doing here? I'm just talking about my feelings. Is this really helpful? How is this going to help me? So it's kind of like this unknown, and some psychoeducation can always be helpful, which is what Dr. Davenport provided him with.
So and prior to Davenport saying, it's not what you have to say, but rather what you want to tell me, I thought it was quite comical that I think in many ways, what you're saying is that Antwone's clearing his throat, almost pretending like it's like he's got a small cough or something like that, or if he's coming down with something. And of course, that prompts Davenport to say, "Are you coming down with something, sailor?" And I thought it was interesting. Like, Antwone wants him to go first, and he's doing these subtle things to get him to go first. And I to be honest with you, I think he's successful at it, even though in the previous session, they kind of just stare at each other. And in the second session, he's like, all right, I have this little trick here that I'm going to get you to start talking first so you can, engage with me as opposed to me engaging with you, like who shot first, right? So I thought that was pretty interesting. But then he starts to open up, about this really, and sort of vignettes, this really traumatic past. So I wanted to get your sense from your experience, what the psych concepts you would be exploring if this is what you heard from a patient.
I'm going to start from the beginning of what you were mentioning, actually, is that those little coughs that he was providing. What I would be thinking in my mind is, this patient wants me to know they're in the room and not to forget about them, even though they're silent. right? And the act of clearing the throat, I would think, wow, they're on the verge of talking and sharing something because it's stuck in their throat, but they can't get it out. So what is the like, it's right there in their throat, but what is it? So I would be very much excited to see or hear the coughing because I would think the silence is going to break soon. Like, we're not going to continue this. There's this anticipation that they're going to talk.
Yeah.
And when a patient does disclose trauma in this capacity, I think it's really important to share with patients that their ability to use the time and space of therapy is going to make them feel worse before they feel better.
I've mentioned that before, yeah.
Right. And I would empathize with the fact that clearly his history has brought him a lot of hurt and pain and sorrow. And we could understand why he has been behaving in such aggressive, impulsive ways and having a really hard time modulating his affect and taking it out on the people around him and really, again, struggling to demonstrate self-control, even within this very controlled environment of the military.
Yeah.
He's still struggling.
Yeah.
So I would just be able to hopefully help him begin to see that his aggressive behaviors aren't just coming from like nowhere. And it doesn't really give us any indication regarding his character that, you know, it doesn't mean he's a bad person. What it means is that every time he aggresses on someone, we know that he's experiencing some level of intense feelings that he's really struggling to modulate. And he takes it out on others rather than himself. Like, Antwone Fisher doesn't seem depressed. Rather, he just seems very angry with the world. So he externalizes all of this, which I feel like is very interesting about his character.
And yet he has this growth journey where he forgives his mother in a very poignant scene, who barely wants to look at him, doesn't say anything, played by the wonderful Viola Davis in a small role before she started doing like really big roles and stuff, and kudos to her for playing this person who is just at the very end of their rope. But he's not angry with her like he was. So the inciting incident to this whole story was barely anything. So this one other non-commissioned officer is just being a jerk in the locker room and comes alongside Antwone and says just something in his ear, and I don't think it's even like it's like it was a common slur epithet that he said to Antwone. It just set him off, and he punches him, claiming that he said a slur in his ear. But I don't think as the audience we hear anything like that. We just hear that him being talked down to almost is what is the trigger. So if he's going through this growth journey, we don't get a sense. That's actually the other thing that I wanted to ask you about. We don't get a sense of timing. We don't know when the film starts. We do have Thanksgiving in there because there is a scene with Davenport's family and Antwone being invited, but then getting flustered and having to leave. But then we don't get a sense of anything that happens after. This is obviously a compressed timeline, I would imagine, for this kind of growth. Can this growth happen within a year?
I feel like it would be challenging within a year, but it can happen.
Okay.
I mean, we see patients who erupt, right? This is kind of what Antwone Fisher does, like you mentioned. Like, he just is set off. He erupts on people.
Yeah.
And now he's at the place where he's forgiving his mom, who, could be, as he could consider, like the source of why he has had the childhood he has had. But there's also this aspect that he's thriving now in comparison. Like, Antwone Fisher is in a foster care home where he's experiencing sexual molestation, and he sees a friend of his who is killed right in front of his eyes. So he's experiencing like a true trauma and grief, because this was the only friend he had that like he felt comfortable with, who would kind of take him in and take care of him as a child when he was sexually abused. And now he is employed. He is in the military. He has cultivated a relationship, a healthy relationship with a physician, a psychiatrist, and he has a girlfriend. He has an intimate relationship that he's also thriving in. And he still seems to have some friends in the Navy too.
Yeah.
That forgive him and actually really understand him. Like when he fights, they're like, here we go again. Like they just know that this is how he's going to respond, and they forgive him.
Yeah.
They forgive him and keep the relationships. So he's had people in his life who forgives him for his assaults, forgives him for his impulsivity. And he is in a place where he's able to advocate for himself. He's able to show persistence and resilience.
Mm-hmm.
So to come to his mother and to see that she is struggling in similar ways as he's very familiar with in his childhood, it seems like he's able to really conjure that he has crossed the barrier. He's no longer in that state of living. He's no longer in that state of mind.
Yeah.
He is now a person who has greater health, emotional health, and can rely upon the resources that he has internalized. So I do believe that that sort of forgiveness can happen.
Yeah.
In a year's time. Maybe that would be, a little fantastical. However, but I do believe it happens. I see it happen with my patients.
Mm-hmm. That's wonderful to hear, actually.
Who's next?
So, Dr. Davenport, sent him to the gym? Hit the punching bags? Ain't that what you prescribing? So why are you here? You feeling under pressure? You feel like a rock is on top of you? Come on now, speak the hell up. You better make it snappy. You only got 3 sessions coming. What are y'all looking at? What you looking at? You feeling sick? You need a healing? You need a healing? Do you need a healing? Huh? Do you need a healing? Some of y'all sick-ass sailors need to come back after working hours. See, that's when a good Dr. Davenport, he'll be laying his hands on you. Or he may have a book in there that may have the answers to all your problems and all your questions. Ain't that right? Ain't that right?
Would you like to step into my office? Are you finished?
I thought I was just getting
Let me
started.
tell you something, son. It may have slipped your mind, but you are addressing a superior officer. You understand me? Do you understand me?
Yes, sir, I slipped up.
You better believe you did.
No, sir, I slipped up when I talked to you.
What?
3 sessions, right?
That's correct.
Can't be flouting regulations.
That's correct.
Well, what do I do, Commander? Because I don't know what to do. I don't know what to do.
In the movie, he's gone through, and you mentioned some of this trauma already. So in the intro, I gave a little brief synopsis of the plot and his background. And we've got father dead before he's born, mother who is on drugs and is arrested, likely for possession. I don't know if they actually say how she's arrested or why she's arrested, but she goes to jail, has him in the correctional facility, is put into an orphanage until he's 2. The orphanage thinks that the mother is going to come pick him up when she is out of jail. She never does. So he gets put into foster care with a very hyper-religious family that also has other foster children. And lots of different issues occurred during his childhood. So what are the kinds of things what are the things that he is internalizing during this childhood? What is he internalizing that is going then to impact him later in life?
Sure. Abandonment.
Okay, abandonment.
And not knowing, like there is no knowing of his father, no knowing of his mother. He even articulates that he would wait for her and fantasize about her.
Yeah.
And so this omnipresence is there lingering over him, and he does not know. So there's a lot of uncertainty as to who he is, where his roots are from.
Mm-hmm.
And then, he's with these other children with this foster care family, and there's a great deal of colorism within this family. Respect.
Oh, right, with the half white boy, yeah.
Exactly. And so, she still calls them very demeaning names, and they all are named the same thing.
Yeah.
However, the way she says it and the tone is very different to this biracial child. And how he's treated is less than significantly, because he is by face a darker child in comparison.
Yeah.
And then he's also chosen for, the sexual pleasures of this individual who's in the home, who is a teenager herself. And then, so there's a lot going on for him regarding, is he accepted? Can he be accepted just by the way he physically looks? Why is he being accepted but for sexual molestation?
Right.
So, what is really his role? And again, who is he? Because he doesn't have any connection to his biological family at all.
Right.
It's not just his parents, but all of his biological family are unknown to him. And so we find Antwone Fisher not just fantasizing within his conscious daily living, but he also fantasizes so greatly that he has dreams about a family that could be of abundance, that could feed him and provide him with all of his early childhood oral needs. I mean, he's dreaming about food on a table that's like a cornucopia of what he would symbolize as love and a way to satiate him. And we don't know who those people are quite yet.
Yeah. Do you think in the writing of the book, the real Antwone Fisher, and then Denzel as the director here, sort of putting it all together, you mentioned, this dreaming of this cornucopia and abundance. We see that physically at the end of the movie with all of his biological family, cousins, aunts, uncles, and like second cousins, most likely, all of these people, grandparents, and this just like spread of ton of stuff with his girlfriend there. I like the subtle reveal of her in the other room. I enjoyed that. So Denzel's putting this together for us, like he has these dreams and he makes it reality. Is that a manifestation at least of these theories that you're talking about? Is this Denzel kind of tuning in to those theories and like giving them to us to pun intended, eat?
Yeah, I do believe so. We see Derek Blue's character, Antwone Fisher, getting to a place where he is emotionally fed. He is emotionally fed by this relationship he has with Dr. Davenport. He's emotionally fed by his girlfriend, where they declare that they love one another and they're vulnerable in that space. I mean, it really just warms my heart the way that happened.
Yeah.
And he is searching, and he also gets to provide, at least in the film, some closure to the relationship he had with his foster family as well. Yeah. So there's an ending, but there's also this promise of healthy, fulfilling beginnings of relationships that are being maintained. And so I feel like the actual visuals of the food at the table with all these family members surrounding it is just, in the event the audience has not seen or understood that Antwone Fisher is emotionally being fed here.
Yeah.
This is going to be the way that he is not just fed, but he's going to be bursting at the close of this dinner, right?
Yeah.
But not, bursting in actual food, but bursting in just being totally embraced for who he is and just for being alive in who he is, which is, I think, what most people want is to authentically be recognized and loved for who we really are. And so we get to see that for him. And like you said at the beginning, good for him.
Yeah. And he took the advice of Dr. Davenport to search for his family. He was, I don't know if content is the right word, but he was, I guess, gearing himself up for a life of solitude until this instigating incident of being demoted, right? Being publicly humiliated, I guess, in the sense of, in front of other service members and his captain and other executive officers, and then having to walk with his tail between his legs to this doctor who he has a bit of an angry outburst about, and then he gets a dressing down because, like, I might be a doctor, but I'm also your superior officer, which I thought was pure Denzel, by the way. That
you mean
scene,
the stare that he gives that commands respect?
Oh my
the
God!
silent stare. Yes,
he is so good. And then his trademark smile and like head bob. It's amazing stuff. Digression into Denzel Love there. So Antwone sets himself up to be like this lone wolf, and then he has this series of events that change his trajectory, and it turns out that is the better path for him. And you brought up the moment where he sees his foster family again. And by this point, we already know how Mrs. Tate treated him and his foster siblings, and we already know at this point how he was molested. And so he goes to this house where they are going to be, and he tells them that you can't bring me down anymore. You were terrible, and I'm not going to let it hold me down anymore. And so he has this like stance of power, which is opposite to how we see him at the beginning of the movie. He may be strong, he may have decked this dude, but he is not powerful. So he goes through this transition, and he specifically tells them, you do not have power over. And, in Mrs. Tate's way, she's, calling him the word that she used, and he's just like, stop, this is ridiculous.
That's correct. I love the fact that you bring this to our attention, that he was strong, but he wasn't powerful. Mm-hmm. And when you said that, the moment I thought, right, because he did not have control. Mm-hmm. Like, power suggests that there is a level of control that is being provided to a situation. And we see Antwone Fisher being very strong, like you said, mm-hmm. like really assaulting people and decking them out and things like that. But he is so out of control of himself that actually it seems that minimizes any power that he could have. Mm-hmm. And this is why it's so easy to just say something in his ear and then just watch this kind of, again, eruption happen. Right. So people have power and control over him, mm-hmm. similarly to how he was as a child. But as he gets to know who he is and be able to prove to himself that he is actually gratified by not being a lone wolf, after all, that he actually enjoys these relationships, that of a person who he looks up to, that's this male figure that almost becomes a paternal figure to him.
Yeah, I was going to say father figure for sure.
Right, that he enjoys this intimacy and mm-hmm. with this person who just likes him for who he is and is willing to at least explore a romantic relationship with him. The more control he begins to take over, because he's learning that who he is actually someone now that isn't out of control and doesn't have to be. Yeah. He'd actually like to harness these feelings and not externalize them, but actually hold them dear to him. The love that he's beginning to feel, it's like he's getting to relish in that for himself rather than just spewing them out in anger. There's nothing to be angry about. He's getting love.
I'm not a virgin anymore.
I'm glad to hear that. How you doing, sir?
I'm great, sir.
Good. Very good to see you. So?
I took your advice. I found my family, and I found my mother.
Good.
Yeah.
So?
In my heart, I forgive her. But if I never saw her again...
I understand.
It's funny to feel that way about your mother. But I did it. And I owe it to you to tell you that you were right.
You owe it to me?
Yes, sir. I needed to find her.
I was right. Those were all the wrong reasons.
Sir?
It stays between you and me, okay?
Yes, sir.
My wife and I, we were gonna have a bunch of kids, and we found out we couldn't have any. And it rocked her to the core. I knew what to do for her, though. She needed help, treatment. I made sure she had it. The best psychiatrist, the one that trained me. But I, the well one, the strong one, at the same time, I went about the business of shutting down. Very subtle, very quiet. It was my little secret. Until one day, a young man came into my office and into my life, and he blew up that little secret right in my face, and he put me to shame in a way I never thought possible. Because of you, Antwone, I'm a better doctor. And I'm learning to be a better husband. You don't owe me anything. I owe you. You're the champ, son. You've beaten everybody who was beating you. I salute you. You hungry, sailor?
I could eat, sir.
Let's go.
I want to quickly go back to what we were talking about because it just popped in my mind with the food. The phrase that I was like, I'm trying to remember what the phrase was, and we were talking about food metaphorically and physically. One of the things that in the screenplay that's come back to a couple of times within the movie, like 3 times or so. It's the second time it's played up for a joke, and then the third time it's just like, yeah, that's what we were doing. It's the
I could eat.
You hungry? I could eat. And in each time is Antwone saying I could eat.
Yes. Because again, we have this child and now this adult who is famished for emotional like connection and desire and intimacy and comfort and love. I mean, he is starving, literally. Yes, he could eat. That is real. And he then learns to trust that the bites that people are giving him, the food that they're willing to give him, is actually something that will satiate him emotionally.
Right.
It's amazing.
Yeah. I love how they put that all together. And when you're talking about eating and all of that, I was like, in film, it's really important that each thing that's said and each visual is there for a purpose, is there for a reason. It's part of the entire storytelling process. You can't have a line in there 3 times and not mean something by it. So yeah, that is perhaps one of my favorites. And when it goes the second time and she literally, so listener, what you have to recognize here is that Davenport and Antwone do this role play in one of their sessions about the date that he's trying to go on with this girl. And Davenport is playing the girl. So Denzel Washington is playing this girl, and he's doing a very poor job of it. But, just has a normal sort of interaction. And it's like, I'm hungry. Do you want to get some food? And allows Antwone to just say what comes to his mind. Fast forward to him on this date with this girl, and she says, do you want to get something, do you want to get dinner or something like that? And it's like verbatim what Davenport says. And so he smiles to himself and he says, I could eat. And then at the end of the movie, when there's this nice little wrap up between Davenport and Antwone Fisher, and he says, hey, you want to get some lunch? And he says, I could eat. And so it's and I think it's the last line of the film.
It is.
Which again makes it super poignant. And I'm so glad we put this all together, because it is great to like hear a vision come through the screen when I watch a movie.
Well, if we even go back further into our conversation today regarding how he was clearing his throat within the therapy session, when somebody's clearing their throat, it means that there's something caught in their throat.
Sure.
Which means that they can't eat. They need to cough that up in order to be able to have access and the availability to eat. And so he does that. He finally clears his throat, and then finally he's able to talk. He's able to disclose all this trauma, which then frees him to actually have the capacity to take in this emotional love and caring.
Yeah.
So he is finally able to eat, whereas before his friends were very caring about him and things of sort, and yet still he used to erupt and things of sort. So whatever this conflict was for him was so stuck in him, it was really choking him and suffocating him until he could finally have a space where he could, again, cough that up and be able to be receptive to whatever food or love, emotional caring, and nurturance that he could finally digest.
Yeah, that's beautiful. So I want to get your sense as sort of my last question here about Antwone Fisher. What is your sense about this small little film with, probably one of the more prolific Black American actors that we've seen in the last 50 years, I want to say? that and maybe Sidney Poitier, but Denzel is currently alive. What this little film means in sort of the a sort of wider scope of Black cinema in your mind?
I feel like it, of course, hits upon a personal story of trauma and helps individuals who have experienced trauma be able to see the power of therapy, the power of engaging in a therapeutic relationship, specifically a Black man engaging in therapy and what that can look like with a Black male therapist as well. I think, it also shows the power of caring and love between two Black men. I mean, Denzel Washington becomes this paternal figure, but Antwone Fisher certainly becomes this child figure for him too. And what isn't highlighted significantly in the film, but there is one scene where we learn that him and his wife are unable to have children. And so we have Antwone Fisher grieving the fact that he doesn't have his family. And we see this parallel process that's happening as well, is that Denzel Washington is also a man who's grieving. He is unable to have children. And so for him to have Antwone Fisher in his life as a patient is gratifying and fulfilling for him. And I think that is a really important part of this film, is for patients may not understand the importance that they hold for their therapist too. And that patients, as they are healing and allow us to help them on their journey, them being in our space and our countertransference and what we're going through, we also experience healing by providing the healing with them.
Oh, yeah, absolutely.
We're on this journey with them, and we are learning along with them. They are just as important to us as they feel like we are to them. And so we get to see that. We get to see that Denzel Washington has a soft spot for him. We see that the boundaries are pressed and widened because of it, for certain. And we see that this early termination of a 3-session does not end up being a termination of their relationship at all. Because they find it hard to close, considering what they've been able to, the work they've been able to do together, and just the genuine care and love that they have with one another. I mean, Denzel Washington articulates that he loves this man.
Yes.
Right?
Yeah.
So, I mean, and to hear that, a patient to hear that from their therapist, I mean, that usually is. I mean, I've been in therapy too. I am in therapy, and I will probably be in therapy for the rest of my life, because I do feel like that relationship with your therapist is such a special one. And to be able to hear that care and support is very similar to what it would feel like for a maternal or paternal figure to be able to say, because they know the raw parts of you in the same way that many parents know the raw parts of their children. Too.
So where would you put Antwone Fisher as a film in the cultural zeitgeist, and maybe more specifically in the Black cultural zeitgeist? Where would you place this film? It came out 23 years ago, so there's been a lot of changes since then, but what does it represent for you?
Yeah, first of all, a must-see. Certainly something that's used in, cinema therapy for sure. That when a patient comes to therapy and they are having a hard time being able to identify what to do with the therapy, this is a great film to be able to say, why don't you take a look at this, especially if they've had a history of sexual abuse, childhood displacement, parent on substances, reunification issues. There's a lot of things you can take from this film to be able to really transpose onto current or your personal therapeutic experience. And so I feel like it's a psychoeducational film in that capacity.
That's a great term.
Right. So I do feel like this is an important film for us, as just in general, as a community of individuals in this world, but also it's a good film to be able to say specifically for Black men who are anxious about receiving therapy services, who are physically aggressive because they're really struggling to be able to understand their feelings and to own their feelings, that we can say that's okay and still come as you are, and we will accept you in this space and work through that, and hopefully end up with a beautiful ending that Antwone Fisher had. And even if it isn't that beautiful, hopefully what you will get out of it is an acknowledgement and an acceptance as to who you are, because when you walk into the therapy space, we're already doing that for you. And so hopefully you can join us in that process. So,
I'm curious if you were aware back, I want to say 2017, 2016, when Twitter was Twitter, there was a hashtag going around, and it was broadly men's mental health, but it was started by a number of Black artists, and it was called #YouGoodBro.
Yes.
And 2017, quite different from 2002, but there is still that continuing conversation, and I imagine that conversation is still continuing within the community.
Yes, it does. And, I do believe that therapy has become much more mainstream than it has in the past, just globally in general.
Right.
But I also feel, people call me a unicorn because I'm an African-American woman's psychotherapist. And so when we see Black men who also have this sort of training, it's like the unicorn you're seeing them cross over the rainbow. It's just a dearth of professional clinicians who are of color, and then specifically male and of color, that then people who want to actually be in a therapy room with someone who looks like them and they feel like, they can do like the Cliff Notes versions of cultural aspects of being able to be understood. It's just very difficult. But I do feel African-American men are more likely to come to therapy, at least now, than what they had before. Like when I first started practicing, very seldom.
Okay.
But now they are more interested in learning about who they are and how they function within our society, and being able to have a safe space to be able to talk about the conflicts they experience, not just within their families, but also within the communities in which they navigate work experiences, microaggressions, and just the expectations that they have upon themselves being men in the world, and how sometimes they feel like it's really hard to actually actualize being the man they want to be because of the world we live in.
Yeah.
So it's been really wonderful when I see African-American male patients utilize the space in what they do, because just like every other patient, they do beautiful work there.
Yeah. I think I'll take a page out of your book and suggest this film, especially when I come across we are an increasingly more diverse school in Central Illinois, because we are recruiting from the Chicago area. Yeah. Each year we get more and more people of color. And not just African American, but Hispanic Americans, Latino Americans, etc. And I think I'll take a page out of your book, and this one, hey, you struggling? I got something that you can. It will take 2 hours of your time.
Right.
I really enjoy that.
I'm so glad we were able to talk about this.
I want to thank Dr. Katherine Marshall-Woods for joining me to discuss Antwone Fisher, and a little bit more of a pun. I think I'm on my pun train. To bookend our conversation, we started our conversation talking about your new book. And so please tell us again the title, where we can find it, all that kind of stuff for the listeners.
Yes, it is Black Film Through a Psychodynamic Lens. You can find it at any bookstore or online. Anywhere online. You can just get it from Amazon, or you can get it from the publisher, Routledge Publishing Home.
Okay.
Anywhere you'd like to get your books, it will be there.
Okay. And it just came out, right?
It came out at the beginning of the year in 2025. It actually had an early release that was a soft release in November 2024, and then it had its grand exposure in 2025.
And were you very excited?
I was, and I was just, I watched 65 films, and so I was just like, oh, right. And so, I'm just like, okay, I get a moment to not watch a film, and then of course I miss doing that. So, that's just my life of watching a film and writing about it, which is, such a joy to be able to offer.
I know.
This to
I mean, can you imagine the kind of fun that we have by doing this kind of stuff? I have a new audiobook out that I promote so I'm not trying to steal your promo or anything, but
Congratulations.
I thank you. And so, I just kind of wanted to burge with you here.
Yes.
Right.
It's so much fun.
So thank you again for joining me, Katherine. I really appreciate you coming on to discuss the film.
Anytime, Alex.
And that's going to do it for this episode. Until the next one, thanks for listening. Bye.